Right, so here we have a very charming patient who tends to have a thinner face. She'd never had a fat full face, so in her case mostly what she needs is some filling in the cheeks particularly. Everybody's cheeks get hollower in the upper part of the cheeks, under the eye, around the cheekbone as we age. And as that happens, it's sort of like taking the stuffing out of a pillow and the skin falls down. It loses all its support. So the first product I'm going to use is a robust filler, hyaluronic acid filler, which most of them are, but a stiffer type. And I'm going to put little red marks in the hollows that she has above the side of the mouth, below the eyes, up on the side of the cheekbones, and these are right on the bone itself. Then when the product is being injected, I'm pulling the skin up and putting the needle in the spot where those red dots were. So we're filling in those hollows and right on the bone. It tends to hold the skin up. So you see instant improvement in the bottom part of the face as well as the top part of the face. We're only using 1 cc, which is 1/5 of a teaspoon, so you really can't get too full, because a lot of patients say, well, I don't want to look like some of these people that are all puffy, and this 1/5 of a teaspoon for both sides will never do that. You can always add another syringe down the road or at that time if you want to, but it's not going to be too much. But people do see the improvement right away in the upper part of the cheeks and the lower part. The smile line, for instance, and the jowls can look better as everything is moved further up. But people just, we don't call it vanity anymore. It's just called a healthy awareness of one's appearance. And if people can look more refreshed and more youthful, it's just a big help in a lot of aspects. And our patient here is a psychologist, and she could tell you that, right? There's been a lot of studies that show that. There's been a lot of studies where they've put applications in for jobs with the same application totally, with a picture of a good-looking person and a picture of a more unattractive person, and the good-looking person always gets it. Yes. Yeah, just raise your hand.